All right, guys. I think we'll get started because time is short. Um, so I was during the day. So I'm Sunny Kishore. I'm part of the planning committee, an MD PhD student. And throughout the day, I kept hearing the word social movement, the words what do we mean by social contract. I heard from Sally multiple times the idea of incorporating patients in the public. And I kept thinking that these same questions or a problem have actually been tackled actually about 100 million years ago by my favorite organisms. 100 million years ago, there were amoebas. Amoebas that were effectively, they had their own ego, they had their own turf, they were effectively silos. And I was looking out the room today and I sort of saw, individual disciplines and professions, et cetera. But at that point in time, 100 million years ago, there was a problem, a fundamental problem that they had to solve. The problem was they needed food. The fundamental issue is they could not find food, so survival was at stake. So what they did for the first time in evolution is to reach out. So one amoeba, a unidiscipline or whatever, reached out and touched another amoeba. And that amoeba then reached out and touched another amoeba. So sooner or later, you had this nidus of amoebas coming together. And then those individual amoebas, for the first time in evolution, formed a slug-like creature. So this creature then moved with a collective polarity towards a food source. And then they started to rise up. So one amoeba would come on top of another amoeba, come on top of another amoeba. And 80% of the amoebas were actually sacrificed, and 20% of the amoebas would move on. So these were the sort of characteristics of a social movement. This was professionalism defined. And if these amoebas 100 million years ago can do it, my question is, why can't we? I mean, as I look around the room today, these sort of dyads and these clusters, we're all amoebas. And we're trying to come together. You can call it patience, you can call it the public, you can call it, medicine or science. This is the issue at hand. And so I want to provoke, we've heard about the past, we've heard about the present, and this panel here, I'm delighted, this panel here is going to tackle the question of the future. So I put up this definition, if it comes up. Just to situate this in the back of your mind, this is what I want the panelists to focus on. So we are defining a transdisciplinary professionalism. I mean, this is a very meaty topic. It took the planning committee some time to come to this, so we want you guys to wrestle with it as well. An approach to creating and carrying out a shared social contract that ensures multiple health disciplines working in concert are worthy of the patient's and the public's trust. The trust is not in there. So I sort of highlighted some of the key terms that I saw. So today we have a student, Eric Cohen, who spent 14 years as a hematology-oncology nurse and then took the bold step of doing a master's in nutrition and integrative health. We have a professor of public health, an assistant professor all the way from India, in Himanshu Negandhi, who has built very interesting new pilot courses. We have, and we can't see him yet, he's coming on, there he is, Seun Adebi, a lawyer who will provide a patient perspective. We have an old colleague of mine, Dave Chokshi, who's a primary care doctor and currently serves as the White House Fellow at the VA. And we have Judy Miller-Jones, a director of the National Health Policy Forum at GW, but who also serves as a caretaker and a patient herself. So I want this community of public participants, of patients, and of students to get into this question of how do we reimagine the future. So guys, what I want to start off with is, can you, and I'll start with you, Eric. Can you just go down the line and give us a bit of your story and also about 4 minutes of remarks on this question?